Hi, I'm Brianna Sloan, and I'm from Bristol High School. I'm a nursing intern in rehabilitation therapies at South Point Hospital. My research project was titled Diabetes as a Risk Factor, and I worked on this with my mentors, Rick Kinser and Carol Snyderwine. So what was my purpose? I wanted to show what's necessary to complete therapy successfully by setting examples through compliant therapy patients with diabetes. I used the Berg Balance Scale to help show that patients can set goals which will end up in better therapy outcomes. So you might ask, what is the Berg Balance Scale? The original Berg consists of 14 questions that help gauge patients' balance or lack thereof. The short form Berg consists of 7 questions and also gauges the patient's balance. It asks the patient to perform simple tasks like standing without a stabilizing device or standing with eyes closed for 10 seconds. The questions are scored from 0 to 4, 0 being unable to do the task and 4 to complete the task with ease. The maximum total score is 28. A score under 23 is considered at increased risk of falling for the patient. This is an example of the Berg Balance Scale. My hypothesis is that patients with diabetes who completed their physical therapy program will have an improved Berg Balance score and/or better outcomes. The following will be considered throughout the course of my research project: a retrospective chart review of patients with both diabetes and a Berg Balance Scale completed. The data was collected based on goals met, Berg scale scores, missed therapy sessions, and patient compliancy. The data was recorded in spreadsheets, and the results were also recorded. This graph shows short-form Berg scores in diabetic patients. 78% of the patients completed their therapy and 22% didn't. So 22% of the patients that did not complete their physical therapy were discharged due to non-compliancy. There was no post-test of the Berg for initial tests to be compared to. So from there, we were unable to determine whether or not they improved their balance. 86% improved their Berg Balance score and 1 remained constant. The 6 patients that improved their Berg Balance score attended 57% or more of their therapy sessions. So the conclusions drawn from this project are that the patient's attendance and participation were major factors in the therapy outcomes, which supports my original hypothesis. The connection between the patient's outcome and therapy attendance or participation stayed constant. The study showed that increased compliance resulted in a more positive patient outcome based on the Berg Balance scores. Even though the scores from patient 1 didn't change, study wasn't broad enough to determine whether or not there was improvement in other areas besides their balance. This is my abstract. So my recommendations are that a larger population that could be studied would show more deviation in the data and results. Better record keeping and better analysis of the unknown diabetic conditions could have helped determine whether or not there was improvement in those conditions. Also, improved communications between the rehab department personnel and the patient could result in better attendance and outcomes. I'd like to thank my mentor, Carol Snyderwine, my co-mentor, Rick Kinser, Lisa Higginbotham, my partner, Maria Ramos, Linda Pasick and Carol Weber, South Point Hospital, my peers for all of their encouragement, and the Cleveland Clinic Office of Civic Education Initiatives. Thank you for the opportunity to present my research.